Hello, everyone, and welcome to the EdLogics Workforce Wellbeing and Health Literacy Podcast. This is Seth Serxner, EdLogics Chief Health Officer, and I'm joined today by Treyce Gladney from United Healthcare. Treyce, we've known each other now for a few years at least. I'm really pleased to have this conversation with you. I'm pretty aware of your background, but actually not your full background. Can you take a second and talk about your current role and a little bit of how you got to where you are today for us?
Yeah, thank you for the opportunity to be a part of this. Excited to share some of the insights I have. So again, Treyce Gladney, I'm the Director of Health Equity and Outreach for United Healthcare, particularly a team within United Healthcare that's called My Community Connections. And we consider ourselves as one of the solutions for social determinants of health across our lines of business. And that team, My Community Connections, has the privilege to work across all our lines of business. Typically, you think of social barriers just impacting maybe someone in the community and state space. But what we've learned, and I think, what generally everyone has learned is that people that are in the forever young category are impacted by social determinants of health, and equally people that are part of our commercial business. So that's a little bit about me, man. I've been with United now for going on 8 years or so. I'm a boomerang. I've left and returned, and my time away had the opportunity to join a federally qualified health center out in Minnesota. It was the largest and still is the largest FQHC in the state of Minnesota, Minnesota Community Care. And one of the things when I was there, I used to like to do was I used to like to sit in the lobbies. That gave me a unique perspective, like that observation, that collecting the qualitative data. What it allowed for me to do is for the things that you could visually see our patients getting off of the bus. Maybe they were walking with family and friends. When they presented to the front desk, you might even be able to tell that they spoke a different language and they were having a hard time filling out their forms. And so that gave me good perspective in terms of how difficult some people have with accessing healthcare. So, yeah, absolutely love to be in the current space that I'm in. Feel like the team and United is really good at being intentional with how they staff, and feel absolutely privileged and lucky to be working on a team with experts in the social care space and feeling like, my contributions are making people live healthier lives. So that's a little bit about me.
Yeah, no, it's fantastic. I so appreciate that perspective. I mean, you just painted such a clear picture that some of us kind of know, but not many of us have sat in a waiting room other than in some emergency room on occasion, maybe. But to really experience what it's like you say, to go up to that window and not be confident in English as primary language and try to communicate that my child is sick or that I have this pain here and I'm afraid because I don't have insurance or whatever it may be, to really see that, to feel that. People talk about kind of research, but it's more human. I mean, we're talking human stuff here. And
Yeah.
I appreciated that picture you painted.
Yeah. And I think for me, my journey, I'm from Houston, Texas, and my dad was an entrepreneur and my mom stayed at home. And I learned quite a few things from them. From my mom, I learned I can do anything that I want to do.
Yeah,
And,
moms are good at that. That's awesome.
you know, I'm the most confident person. Like to your point, moms are really good at that. But my dad, so his business was detailing cars.
Okay.
And it was my first job when I was growing up, is that I used to have to wash cars. I identify because of that experience, I identify as a blue collar worker even today. Like when I think about cultural competency, understanding different perspectives and being aware of your belief systems and things like that. My dad identified as Muslim and my mom identified as a Christian. And so I grew up in a household where I was confronted with these
Yeah.
two belief systems and I
Yeah.
was forced to be really culturally competent. But to go back to my dad washing cars, so, if you ever spend any time in Houston, the one probably word that describes Houston is humid.
Gothic.
And so, like, I think there is, some general consensus around Houston being a very humid place. And so in the summer times, I used to be soaking wet. I was
Yeah.
filthy. I was hot, but I still had to interact with, maybe at lunchtime, we had to interact with food services. At the end of the day, we might have had to go to the grocery store and get groceries. And I learned that, from my dad, and I looked at him having just completed a hard days of work, that he was no different than anyone else, right? Now, his experience might not have been the same, but he was no different. He was a normal American just trying to make things work. And I think that gives me a keen eye in terms of like just seeing people, as an organization. And for most folks, like there are populations of people that just aren't seen. And, I try to see those folks there.
It's so important. Thank you for sharing that, and I appreciate it. I pumped a little gas in my time and did some, labor on construction sites. So let's fast forward a little bit. So now you're, as you said, you're this director of health equity and outreach, and you're trying to do this for populations in need. What does that look like when you're doing programs and services for populations to try to improve health equity and literacy? And what are the key components of that?
One, I would start off to say this work is really hard and it is hard for a lot of different reasons. And so typically what I do is try to get alignment on like key definitions as we talk about them. Health equity is one where I use Robert Wood Johnson's definition on health equity. And that is, everyone deserves to be as healthy as possible. And that's kind of the first part of that definition. The second part of that definition is that in order for everyone to be as healthy as possible, it requires us to remove barriers of care. And so there is a realization that with that first part, not everybody is as healthy as possible. Man, there are health disparities, right? The two that maybe disparities that have a lot of airtime are, infant and maternal mortality. Black moms are 3 times more likely to die from a pregnancy related condition than white moms. Access and affordability. I used to live in Minnesota, and when after the George Floyd murder, my wife and I made a decision to move a little closer home, a little closer to access to family and friends and a broader network. And so there's a lot of different reasons that we made the decision to leave Minnesota. But when we got there, it created a perfect path for us to help, my family and particularly around daycare. And so, and I'm talking, this is under this broad theme of access and affordability. And the disparity is that Black and brown people are less likely, they're more likely to, defer and they're more likely to not seek care because of the cost associated with it. And so within the first year when I was back home, my mom fell. And when she fell, it was terrible. She looked like Mike Tyson had hit her eye. She eventually went to seek care. And the conclusion of that was she felt like her doctor didn't treat her the right way. Like this inherent distrust with the provider community.
Yeah.
I think that, there's probably a lot of different reasons why, but that was one of them. And so this story would be over. Like, you know what I mean? Like I would love to have ended the story there. But a few months later, my mom fell again. And this time when she fell, she ended up breaking her leg. We didn't realize she broke her leg until almost 3 months later, because when she broke her leg this time, because of the experience with her falling the first time, she was like, like I just went in and they didn't, the health system didn't treat me the way that, I thought I should have been treated, and I didn't get the experience that I thought I wasn't supposed to get. And so she decided to forego, right, that access to timely care that improves your overall health outcomes. And so, like, this stuff is, way more than a job for me. Sometimes you get people that are like, this is a job type of deal, and it's a great job. It's a great organization. But for me, this is personal. It's a passion, but it's also personal because there are hard things that we're trying to solve. Health literacy is part of that conversation as well, in terms of being able to understand. You got to understand things on a lot of different dimensions type of deal. You know what I mean? Like, you got to understand, use that information, and then be fluent to take action once you understand the information. And so there's just a lot there, right?
I think, I mean, and I feel for you and your mom. We've talked during that or around that time too. My mom had this something like that, but not the treatment. She had the different treatment. She actually had great treatment. Didn't end up so great, but I think this idea of, just treat me like a human, just see me. This issue, these unconscious biases are big, like you say. That's not like oh, well, here's the program to fix that. Here's the training to fix that. And I think, in my view, part of this health equity that you talked about, which I love the Robert Wood Johnson definition, for me, part of it is that it's health disparities that you describe. Blacks, browns, people of color get different treatment for various reasons. The health literacy piece that people are addressing. And then your other piece, your social determinants piece, social needs. There are people just purely lacking for, again, many root causes that are hard to drive down to, as well as kind of a personal skill set people call personal determinants. It's all this kind of multifaceted factors that we're working on, and you kinda don't know which one to play out at which time, or like, "Yeah, let's fix this piece, and then there's that piece." So how do you reconcile that it is a bit complicated, right? It takes more than one solution. How are you guys taking it on?
Yeah. So, as an organization, acknowledging that social determinants of health, consistent with the CDC and many other, credible sources, that they have as much as 70% of impact to someone's overall health. And so even if you ace the test, you got all the access in the world, you just got 30%. There's like 70% other things that could influence your
Yeah.
overall health, right? And so for us, it is one of the things we want to do is understand it, right? So we want to understand what social barriers our members are having. We do that a lot of different ways. After understanding some of the social barriers folks are having challenges with, we want to make sure we can connect them to high fidelity resources. They might be resources that are local to the community, or they might be like much broader national programs that are hard and complicated to fill out. You think of like WIC or SNAP, or, kind of these things that require a lot of paperwork. And then the final thing for us is just making sure that we're following up with our members. Like, we actually care about them. And so we want to follow back up with them and to see if we were able to help them. And all of that gives us access to like member level information, member level insights in terms of social data. It highlights, could potentially highlight even more disparities where at a community level, there are groups of people that might be experiencing some challenges in a lot of different places. And so that allows us to be super creative. Health literacy is one that we're particularly interested in. And I was trying to think through, like right now, how to ultimately get to the health literacy piece of it, because the information is important, right? I mean, you think about when you learn how to drive, right? There was driver's ed at the front part of that, right? You got to understand that, if you run a red light,
The rules and
or
yeah.
there are rules to the road that you got to understand, right? And then, that kind of core rules to the road eventually led to this practice where it's a, instructor led, where you're actually learning how to drive. But the evolution of that, like if you go one step forward, is like you actually get the keys to the car, right? You get the keys to the car. And once you get to the keys to the car, you got to know directionally where you're going, how to get to point A to point B. You got to be able to make sure that you're, providing the sufficient maintenance to the car as well. You got to put gas in it. You got to You got to change the oil, right? There's a lot of things that you have to do. And so when I think about that health literacy piece of it, for me, it is that first piece is important, man, that foundation. Like I remember being a student, learning the rules of the road. Like I just remember that vividly in terms of it being, how do you actually start there and then like influence your next specs out, your action, your health outcomes. I think all of those tie together when you become really fluent. And I think that there's a lot of different people, and we'll go back to this car analogy where, their bodies are their cars and they're running out of gas and they have no clue, right? They're
The way I feel about health literacy, we've been stuck in driver's ed. Like I learned in California in some old bungalow with some guy and a bunch of bored kids, and it was old school. And we're still there with the way we do health literacy education for people and where we could go to help people with the skills they need, the confidence they need, the ability to navigate their own journey, whether it's a well journey or a sick journey or whatever, and how to maintain that. Well, now we use virtual reality, right? When we teach people stuff, everybody learns via YouTube. They learn from multimedia and infographics and songs and cool stuff. So, like, even with EdLogics as an example, they teach you with games,
yeah,
quizzes and facts or myths and little, sweepstakes and things and challenges. There's got to be a way that works for, I love the first word in the RWJ, everyone. Works
yeah,
for everyone.
yeah.
And that driver's training all the way to you got the car, man. You gotta know how to take care of it. There's an owner's manual here.
Everyone deserves to be as healthy. To me, there it's multi, it's the realization that has to help work for everyone, but also health is personal.
Yeah.
How I define health is completely different than the way that you define health. How I like to be engaged on health matters might be different than the way others like to engage in health matters. I mean, like, I love the gamification model. You know, I have very young people that I know that love to, like, when I look at them, they're playing the games. They're doing,
Exactly.
and there's no real
Really.
reward to the game. It's like that they're just playing the game and they like to play the game with more than one people. It's like being in bingo. You think
Yeah.
of like bingo, it's like 3 or 4 of them that are combined in terms of like, this is what I learned. And so to be able to provide health information in an easy way that has some gamified solution around that is really cool. And then equally to say, it's the forever young, but it's the actual right now general population as well, where everyone is just so used to getting information that way. I think the fabric of America has changed, and there are some accelerators in the market that, I mean, we're not going to go back, right?
Let's take the Medicaid population. I know we talked a little bit about the commercial population too, where we know that just because you get a paycheck and you have health benefits, you can still have, needs and gaps. But
Yeah,
in the Medicaid, you describe that kind of connection model so well in the closed loop model. Do you see them? Hopefully, we may test this, but
yeah,
this idea that providing some engaging, learn it the way you like to learn information could help people really navigate a bit more.
yeah, absolutely. I think so. To your point, the intervention needs to be connected to the ultimate outcomes. Like we need to, a lot of times people hear testing and they're concerned. And there are other more sophisticated organizations that I think like EdLogics that hear testing and like perfect. Like, we want to establish a methodology for what we should be looking at to produce the evidence that we are making a difference, that by providing access to education and training and delivering it in a way that's more meaningful, that it will improve overall health outcomes. And I think that for us, there's a couple things, and I think there is the broader dimensions around social determinants of health and how we eat. Like we're in this topic around measurement is what should we be looking for in terms of measurement, right? If we follow our quality, timeline and the way that we've historically done measurements in the past, we know that those measurements, like there have been quality measurements introduced across the healthcare space for years, and like health outcomes haven't improved. And so we might be looking at the wrong measurement. The reason I bring that up, two dimensions. One is I think there is some innovation around measurement that can happen. Like, what leading indicator should we be looking at, or what lagging indicator should we really be looking at? And then, in terms of like Medicaid, who's represented in that population, and how might we tailor that solution for that population? So yeah, I totally agree with you for sure, Seth.
We live in a tricky place. And, I was a United Health Group person and very compassionate culture, very on mission, and also very data measurement oriented, wanting to be evidence based, all those good practices. And yet it's tricky, as you said before. It's hard because these are humans. This is a lady getting off the bus with a couple of kids, taking time off, maybe not speaking the language, having a bad experience beforehand, all those factors. So, like, what is driving her health and well being right now? You
Mhm.
know, we just listed 8 things. So how do you do a survey to measure her and then her after wellness, So we wanna be really disciplined, and yet we wanna really be human about it, and it's,
Yeah.
really challenging.
Yeah, for sure. I agree completely. We want to make sure we understand priorities, what's important. Again, back to that RWJ's definition, how I define health might be different than the way you define health. The thing that's important to you might be not important to me. That line of sight is important. I mean, understanding priorities is really important, right? And then equally being able to provide these culturally competent solutions that are unique and different, that are consistent with the way people are used to getting information. I mean, to me, that's the holy grail. We didn't talk a lot about language, but to me, it's like almost a lack of innovation needs to happen. And that lack of innovation is that if a person speaks, whatever their preferred language is, whether it be Spanish, whether it be Mandarin, whether it be Korean, whatever it is, like at its core, people should get the information they need in the language that they prefer. That should not
Pretty
be a barrier.
pretty base. That's
Yeah,
like,
that's like big
you know
stuff, right? Yeah.
yeah, yeah. No, I appreciate it so much. I appreciate this conversation. We could go on, and it is such a big sphere of work. And I just appreciate the work that you and your teammates are doing. And I want to thank you also for how personal you made this and how you shared that. I hope one of the things that people take away from this conversation is this is real for people. This is really important stuff. It's not just kind of clinical and how do we reduce healthcare costs. This is, as you say, this is about moms and families and others and communities. So thank you everyone for listening. Really appreciate it. And thanks again, Tracy.